Hello everyone, this is a short 2-minute video on a very important topic that is called actinic keratosis, also known as solar keratosis. Whenever we use the term actinic, the dictionary meaning of the word, basically, the medical dictionary meaning of the word, that is something which is associated with the damage of the skin by the ultraviolet ray. So from the name, you get an idea that some skin changes, some keratinocytic changes is occurring in the skin due to sun damage. And that's why this condition is also known as solar keratosis. Now, why we learn about this lesion? Because this is a very important pre-cancerous skin lesion. It's basically precursor to a skin lesion, that is squamous cell carcinoma. It can progress to squamous cell carcinoma. That is the significance of learning about this lesion. Squamous cell carcinoma of skin. Now, from the name, you also get an idea that two important things you get an idea actually, which I would like to highlight. That in this condition, the changes which would be seen, that is quite typical or characteristic. This is which I've drawn, this undulated line. This is basement membrane, BM. On the top of this, we have epidermis, and below to this, we have dermis. So you know that epidermis has multiple layers, but the first layer which you usually get is basal layer, stratum basal. Now what we see in this stratum basal layer in this condition, we get some form of dysplastic changes. Dysplastic means precancerous changes, which is due to this sun damage. So one important aspect of this condition would be seen, that would be dysplastic changes in basal layer of epidermis, stratum basal. And also you'll be getting another change on the topmost layer of the epidermis, that is the stratum corneum. In between there is granulosum and spinosum, you know. But I'm only talking about two layers because these two layers, the changes, important changes would occur. In the stratum corneum layer, we'll be getting that stratum corneum layer is thickened. And the stratum corneum layer, there is retention of the nucleus. Normally in the topmost layer, stratum corneum, the cells are dead and they don't have nuclei. But in this condition, we'll be having nuclei retention. This is called parakeratosis. So parakeratosis, along with thickening of the stratum corneum, this too is characteristic of this condition. Parakeratosis plus thickened stratum corneum. Plus, you'll be getting another important aspect that is called solar elastosis. These are changes are usually seen in the epidermis. But in the dermis, we'll be getting another important change that is called solar elastosis. Solar elastosis means in the superficial dermis, due to the damage by the sun rays, these fibroblasts, they would be depositing some gray, abnormal grayish blue elastic substances in this topmost upper dermis area. And these changes are called solar elastosis. So if you get solar elastosis plus dysplastic changes in the basal layer plus parakeratosis and thickened stratum corneum, these changes are quite characteristic in the skin biopsy. Grossly, this skin, if you touch it, it shows a characteristic sandpaper consistency or sandpaper texture. And you'll be seeing them mostly in the sun exposed area, obviously, because this is happening in the sun exposed area of the body. Who are more prone to develop these conditions? The patient profile. So if I go to the patient profile for actinic keratosis, typically it would be a 50 plus male who is white skinned, because there's more chance of sun damage. And in the sun exposed area, you'll be getting this lesion. And sometimes they can have a horn-like appearance called cutaneous horn. So it's like a pump over the skin, like a horn over the skin. Horn means like you get the horn of the cattle. So if this is a skin, on the top of that, you get some form of horn-like lesion, which has a sandpaper-like texture. So this is the typical appearance and the patient profile. It would be in sun-exposed area. And now, lastly, what is the importance of this lesion? I told you that actinic keratosis, can progress to carcinoma in situ. And then it can progress to invasive squamous cell carcinoma, full-fledged squamous cell carcinoma of the skin. The idea is simple. So, and in a way, this AK is quite similar to your cervical in the female cervix, what we see, that is the CIN, cervical intraepithelial neoplasia or squamous intraepithelial lesions. So it's quite similar to pre-malignant lesions of female cervix, uterine cervix. Lesions of female uterine cervix. Now the idea is simple. I told you that suppose if you imagine this is a basement membrane, and I told you on top of this there is epidermis, 4 layers, and below there is dermis. Now initially at the actinic keratosis level, the dysplastic changes would be only seen in the basal layer. And now if the dysplastic changes become more prominent in the upper layer also, that would become carcinoma in situ. This spectrum would progress. And then ultimately this could become invasive when this basement membrane get breached. So that is the basic idea of the actinic keratosis or the solar keratosis. So in a nutshell, what we learned about solar keratosis or actinic keratosis, it's a pre-malignant lesion of the skin due to the ultraviolet ray induced damage to the skin, appeared with a sandpaper texture, usually in the sun exposed area. Typical patient would be 50+ male who has overexposure, working for long period of time in scorching heat of sun and being damaged by the sun rays. And the patient would be having on the skin biopsy the typical feature of hyperkeratosis, parakeratosis, basal layer dysplasia, and the degree of dysplasia in the basal layer would dictate severity, would dictate that is it going to progress or not. Not all cases would progress, some cases would regress also, but only some cases they can progress to squamous cell carcinoma. So you keep it in mind that not necessarily all cases of actinic keratosis is going to progress, only a minor percentage. And lastly, this is quite similar to the uterine cervix. We see the pre-malignant lesions like SIL, squamous intraepithelial lesion of the uterine cervix. So that's all you need to know about the solar keratosis or actinic keratosis. Thank you very much.